A strong economy and low jobless rates have left many employers struggling to find the skilled workers they need to meet demand. It's especially true in our region's healthcare sector, which is contending with an aging workforce, even as it benefits from an aging population that needs more services. Well, recently, Allegheny Health Network, a unit of Highmark Health, which sponsors this program, turned to a company called iRelaunch for help. Together, they're recruiting nurses through a new return to practice program. The goal is to encourage them to transition back to the workplace. And Zacharias is Director of Business Development for iRelaunch. Claire Zangerly is Chief Nurse Executive at Allegheny Health Network. And Bonnie Edison is an AHN Return to Practice RN at AHN Forbes Hospital. Welcome. Good to have you all here.
Thank you. Good to be here.
Yeah, we had you on here before. You were just bringing iRelaunch to our region. I take it it's going pretty well right now.
Things have gone well. We've worked with a number of clients, but one of the most exciting programs that we've done is with AHN and their Return to Practice program.
Yeah, and the whole rationale behind iRelaunch is there's a lot of folks on the bench around here who could be available to work if they could find the right pathway back in, right?
Exactly. I mean, what we do is we work with professionals who are ready to return to work after taking a career break, most often for child care or elder care, and sometimes they think they don't have the skills to return, but in fact employers are really interested in this experienced talent pool.
Yeah, and Bonnie, was that you in terms of being out there? How long have you been, how long's it been since you were practicing professionally as a nurse?
It's been 23 years.
Wow. And so you wanted to get back into it? Was it kind of daunting to think after all those years how you would do it?
Yes, it was. In fact, I thought I probably wouldn't be able to, but then I came across this program.
And so from AHN's perspective, part of the solution, you think, to making sure you have the people you need to provide the care?
I think it is one of the many solutions that we're tapping into. We know that there are 250,000 nurses just in Pennsylvania alone, and I thought to myself, I bet not every one of those nurses are practicing. I had friends who aren't practicing because of the rigid schedules that we sometimes put in place in healthcare because we're a 24/7 business. Nurses that have been out of the profession have gone out of the profession for a reason. They can't put the 12-hour shifts in. They might not be able to work every other weekend, or they've just chosen not to do that. So we created this program to meet nurses where they are, because we can use a nurse at any time of the day, 24/7, 365 days a year. Even if they come in to work for 4 hours at a time, we can plug them in anywhere, and they help reduce the current workload of the nurses, and they serve such a great purpose. And it also gives them an opportunity to re-enter the workforce as a nurse. And we just are so excited about the potential and some of the success that we've already had with the program.
Well, it's fascinating. So Bonnie, what were you thinking you'd have to come back into the profession as, or kind of at what level within healthcare?
I was actually looking at medical assistant positions with Allegheny Health Network, and then I came across this program for the RN Return to Practice.
So there's like a refresher course that's part of this? And there is a lot of catching up to do. A lot has changed in 23 years.
A huge amount, and yep, I'm taking a refresher course and all sorts of new things that are going on in the profession, and it's a challenging course, but it's a good course. I feel like I'm learning a huge amount.
And I guess you have to be willing as the employer to make this work and be flexible and to bring these kinds of people along. Right?
Absolutely. So we put them through the refresher course. We pay for the refresher course. We also get them to shadow on the nursing units with preceptors, and that actually introduces them back into the profession. I can tell you it's also a logistics exercise to get the scheduling all together, because we give the return to practice nurse the choice. You tell us when you want to work, as opposed to us saying, here's your shifts. Now, of course, their wages aren't as high as a nurse who would work full-time or permanent full-time or permanent part-time, but this is a terrific entry point for nurses who want to come back into the profession, and we really make a huge effort to shepherd them along this journey.
And a great example, though, to make this work, you have to have employers who really understand the need, but then are willing to sort of change the way they do business to make this succeed. need, right?
Exactly. And what we did in partnering with AHN is that, you know, first of all, they promoted the program to our community, among other places, so that to get the word out. And then we had a kickoff program where they brought in our founder, Carol Fishman Cohen, to talk about, you know, confidence strategies, return to work strategies, how to navigate the change with their families. And then she did a fireside chat with Claire, and Claire's knowledge and enthusiasm about the program was so infectious and palpable that there were people I know that expressed interest that they wanted to join the program that day on the spot.
That's incredible. And think about it, it's more than just the technical skills. There's like a whole thing to be back in the workforce again. So you feel like it's all coming together for you now?
Yeah, it is very daunting, and there's a certain amount of stress that goes along with it and anxiety. But the support from the online refresher course and the support from AHN has been really good. And so I don't feel like I'm alone, and the support from the local hospital, the manager that I will be working with, she said we'll work with you, and so it's not like I'm alone. I'm part of a team.
That's really exciting. So if there are other nurses out there on the bench, how do they find you? Right?
Oh my gosh, just go to our website, the AHN website, and we are right there front and center, and we will talk to you about your own journey. This is personalized. Every journey is different, and we are happy to help you navigate that journey. And the way I look at it is, if it's one nurse at a time, it's one nurse at a time. And I'm so excited to bring people back into nursing practice, because as a nurse, you've contributed so much already, and leaving and coming back, it's your second life.
And then employers online can look for iRelaunch as well if they want to follow the AHN model, right?
Exactly, iRelaunch.com.
iRelaunch.com. And Zacharias, Claire Zangerly from AHN, Bonnie Edison. Welcome back to nursing.
Thank you.
Congratulations. Yeah, take care.
Thank you.
We'll be back in a minute with little dollars and cents. Please stay with us.